Hi, my name is Melissa Ayers, and I'm going to talk to you today about multiple sclerosis. This is a disease I didn't know a whole lot about, so I thought I would study it and share it with you guys. So I got most of my information from the 3Ps book. The authors are Crowley, Kochanitsky, Kay, Wallace, and Letts. So let's get started. Multiple sclerosis, or MS, is known as an anti-inflammatory disease. It is driven and caused by the immune system, we think. We do not know exactly what causes it. It is a very prevalent disease. It is hard to diagnose. The disease attacks the myelin sheaths of the nerve fibers. It leaves holes in those fibers, and those fibers fill with plaques, and those plaques stop the communication from nerve to nerve. So if you'll picture a chain and you take links out of the chain, that's what happens to communication in the body. Communication for movement, communication for speech, communication for eye movement. For everything in the body, there has to be a clear and easy form of communication for those nerves. It breaks that down. So that explains kind of why the body just goes haywire. So the destruction of the sheaths can also appear in the brain and spinal cord, and that's pretty serious. That would present probably very prominently. MS can affect any age. It can affect children, adults, adolescents. It's rare that primary onset is in when someone is elderly. However, these patients, if well controlled and they have a light case, can live to be elderly. The primary treatment is to just control the symptoms, and we'll get to that. But the disease is known to be very insidious, so it can present it can mimic a lot of other diseases with its presentation. So it can present with just vision changes, fatigue, muscle weakness, memory loss, just a light case like that. That would make me think hypothyroidism. It would make me think maybe depression. It would make me think possibly a viral illness. I mean, the way that it can present can be it can trick you. It can make you think a lot of other things if you're not, on point. So some of the more serious presentations of MS would be incontinence, loss of balance, and paralysis. And I really think that loss of balance is what leads a lot of people to seek treatment. They just kind of become stumbly and like my legs just aren't doing what I need them to do, or my arms just aren't doing what I need them to do. And I think that's what brings a lot of people to seek treatment. So when a physician or a mid-level provider sees a patient with MS, it's important to do a complete neurological and physical assessment because the areas that are affected outwardly can help us diagnose where the MS is attacking inwardly. So if a person presents with loss of balance, then we know that it's possibly in the brain or the spinal cord. Okay. Diagnosing MS can sometimes be hard. It can be a lot of testing to rule out other things before maybe the light comes on and we're like, oh, that's MS. So B12 and vitamin D, we can give those to rule out any abnormalities. We can do a TSH to rule out any thyroid disease. We could do ANA, ESR, and CCP to rule out any autoimmune factors. An MRI of the brain and the spinal cord, depending on the symptoms, we would do that. And finally, a lumbar puncture. So a lumbar puncture, again, to rule out any kind of meningitis, any other issues in the spinal fluid or in the spinal cord. That's very important because any abnormalities or infections in the spinal fluid can cause a lot of bad outcomes. So as far as treatment goes, there's no cure for multiple sclerosis. There is only treatment available to help quiet the symptoms and decrease inflammation within the body. We do want to decrease that inflammation. That is a driving force in treating this. Treatment will include corticosteroids, disease-modifying drugs, and immunosuppressives. We got to quiet that immune system because it's attacking itself. The goal is to decrease the overall inflammation in the body and slow the disease progression. MS is fatal, however, these patients have many good years prior to decreased quality of life due to the disease progression. That's it. That's all I got. Thanks.